Welcome to An Introduction to CLOCC. The Consortium to Lower Obesity in Chicago Children is a nationally recognized childhood obesity prevention program housed at Ann and Robert H. Lurie Children's Hospital of Chicago. It has over 3,000 participants representing over 1,300 organizations. CLOCC is data-driven. It is a citywide consortium using innovative multi-sector collaboration that is focused on strategies to link knowledge to action, and CLOCC uses a grassroots approach. Our mission is to confront the childhood obesity epidemic by promoting healthy and active lifestyles for children throughout the Chicago metropolitan area. Our work fosters and facilitates connections between childhood obesity prevention researchers, public health advocates and practitioners, and the children, families, and communities of Chicagoland. CLOCC's goals are to improve the science and practice of childhood obesity prevention, to expand and strengthen the community of public health practitioners, community leaders and organizations, clinicians, researchers, corporations, and policymakers working collaboratively to confront childhood obesity in Chicago and beyond. And to expand public education campaigns which shift our local culture towards one that supports lifestyle measures that will bring about reduction in childhood obesity in Chicago. Our goals are also to cultivate a long-term, broad base of government, philanthropic, and industry funding to sustain childhood obesity prevention work in Chicago and beyond, and to identify culturally appropriate and relevant childhood obesity reduction approaches that work and disseminate and institutionalize them at all levels of social ecology, including individual, family, community, institutional, and public policy. While CLOCC's work is designed to improve individual health, that work takes place surrounded in the context of family, community, and society. Barriers and opportunities to prevention exist at each level of this model, and success depends on enhancing opportunities and reducing barriers at each level. This approach is sustained largely by partnerships. CLOCC's organizational structure includes staff that are guided by our executive committee, our partners, and the Chicago community. We are also guided by members of our external advisory board. For more information about CLOCC staff or our advisory boards, please visit clocc.net. Blueprint for Accelerating Progress in Childhood Obesity Prevention in Chicago the Next Decade was released in January of 2013. It is a 10-year plan to make a significant leap forward in childhood obesity prevention in Chicago, not just what CLOCC can do, but also what organizations across the city can accomplish. It includes 6 areas of focus: food and beverage access, physical activity and the built environment, school systems, early childhood, business sector and industry practices, and health promotion and public education. Please see our website for more details on the blueprint. Consortium participants can join one or more of CLOCC's interest groups, where they can interact with other participants in a small and focused context. Interest groups encourage participation from members with different areas of expertise so that groups have a wide variety of perspectives. Groups meet a minimum of 4 times a year, including immediately prior to each quarterly meeting. The goal of the Early Childhood Interest Group is to strengthen CLOCC's focus and expertise with early childhood initiatives. The ECIG defines early childhood to be pre-birth through age 5. This interest group serves to build and strengthen relationships that link early childhood stakeholders to valuable resources that support obesity prevention and healthy lifestyles. The Food Access Interest Group focuses on access to healthy foods and beverages in support of childhood obesity prevention. This group will begin its work with the development of initiatives to support CLOCC's blueprint for accelerating progress in childhood obesity, and the implementation of a recipe for healthy places addressing the intersection of food and obesity in Chicago. This interest group connects advocates, practitioners, policymakers, and others whose work interests align with these 2 plans and other food and beverage access priorities. The Health Promotion and Public Education Interest Group is a network for those engaged in health promotion for childhood obesity prevention in clinics, classrooms, or any community setting. Our goal is to create a space for professionals to share best practices, develop skills in health promotion, and to work collectively to promote evidence-based health education approaches. The Physical Activity and Built Environment Interest Group is focused on increasing physical activity for transportation and leisure through improvements to the built environment, which includes streets, sidewalks, and green spaces. Our goal is to connect advocates, practitioners, policymakers, and more with an interest in this topic to learn and exchange best practices with evidence-based interventions that improve access to safe opportunities for physical activity. The Policy and Advocacy Interest Group brings together CLOCC's policy and advocacy focused partners, including both governmental and non-governmental, to serve as a childhood obesity prevention policy resource for the consortium. Members of the interest group discuss innovative policy and advocacy approaches to work in childhood obesity prevention, make connections for future advocacy work, and support CLOCC's goals and strategies. The Research and Evaluation Interest Group is focused on research and evaluation in support of childhood obesity prevention. This group welcomes research and evaluations practitioners, those interested in evaluating their agency's programs, and all others with an interest in childhood obesity prevention research and evaluation. This group is particularly interested in and focused on community-engaged research and evaluation in which communities play an active role in research and evaluation. This group will share new research and evaluations findings, explore common issues in conducting research and evaluation, and collaborate and strategize on common efforts. The Schools Interest Group is focused on the role of schools in childhood obesity prevention. Our goal is to serve as a meeting place where common interests can be explored and expertise shared regarding best practices in creating healthy school environments. We are focused on identifying and sharing strategies to support schools in implementing the policies and practices that promote healthy eating and physical activity. The School Systems Interest Group will explore common issues in working with schools, share updates on new initiatives and related research and evaluation findings, and collaborate on common efforts, including biannual professional development workshops offered through CLOCC's Healthy Teacher Network. CLOCC's school-focused community initiatives provide resources and partnership connections for schools on obesity prevention through the Food and Fitness Network. We work with partner organizations to assist schools in identifying priorities for creating healthy school environments and achieving CPS's Learn Well criteria. Our schoolwork organizes professional development workshops for schools through the Healthy Teacher Network. CLOCC's community work focuses on policy, systems, and environmental change strategies to ensure that healthy options are widely available. Policy change represents when an organization adapts a healthy food policy or a bill is passed to improve access to healthy food. Systems change occurs when schools, corporations, and other institutions create mechanisms to support healthy behavior. And environmental change occurs when physical activity environments are modified to support healthy eating and physical activity. We do this by providing technical assistance, tools, and support for organizations in implementing PSE strategies. We focus on key areas of the blueprint, such as increasing access to healthy food, improving the built environment, promoting walkability, and expanding access to drinking water. A key example of a CLOCC-led community initiative was the implementation of Healthy Places from September of 2010 through April of 2013. This included work in healthy corner stores, walkability, breastfeeding support, and school wellness. CLOCC's evaluation department conducts a variety of program evaluations, trains organizations in obesity prevention program evaluation, and consults with organizations engaged in obesity prevention as our resources allow. 3 areas of evaluation include evaluation of CLOCC via an external evaluation team to assess our effectiveness and usefulness for our partners, as well as technical assistance for our partners regarding program evaluation and evaluation planning, and evaluation of CLOCC's projects. Examples of CLOCC-led policy initiatives include the Illinois Childhood Obesity Prevention Consensus Agenda, the Interdepartmental Task Force on Childhood Obesity established in 2006, CLOCC's Policy Review Protocol in 2008, CLOCC hosted Child Health Examination Surveillance Systems Summit in 2008, and a Physical Activity in Schools meeting also in 2008. CLOCC has implemented a participatory process to create our policy agenda and endorsed a number of childhood obesity prevention bills and policy initiatives. As well, we send action alerts to our network when appropriate and serve on various policy-related task forces and committees. CLOCC maintains multiple resources for our partners, many of which can be found at clocc.net. CLOCC uses its public education message, 54321-GO, to communicate daily recommended behaviors that promote a healthy lifestyle for children and families. This message includes the recommendations for 5 servings of fruit and vegetables a day, 4 servings of water, 3 servings of low-fat dairy, 2 hours or less of recreational screen time, and 1 hour or more of physical activity. 54321-GO resources include downloadable flyers with suggestions for parents and caregivers on helping children achieve the daily recommendations of 54321-GO. These flyers are available in multiple languages and available at clocc.net. We also maintain a list of outside websites that promote part or all of the 54321-GO message, and also provide curriculums and activities, which include free lessons plans that promote part or all of the message. These can be used by community organizations or families. For more information about 54321-GO, about trainings or additional resources, please contact Elizabeth Gonzalez. Unveiled in spring of 2016, 5SMART is CLOCC's new health message for pregnancy and for infants and toddlers. 5SMART promotes recommendations for sleep, meals and snacks, activity, role modeling and responsiveness, and things to avoid. Find additional resources, including English and Spanish flyers, at clocc.net. A key component of addressing the childhood obesity issue is finding ways to integrate more physical activity into the daily routines of children and families. One of the easiest ways to integrate more physical activity is walking. However, many people are concerned with the safety and walkability of our local neighborhoods and communities. For this reason, CLOCC created the Neighborhood Walkability Initiative. The Neighborhood Walkability Assessment Tool is an evaluative resource available to any group, organization, or school wanting to assess the walkability of their neighborhoods and then take action to fix the issues. For more information about neighborhood walkability, please visit our website. CLOCC is pleased to offer a library of data collection tools to our partners as part of our research and evaluation tool library. All resources are available free of charge to our partners working on childhood obesity research and/or evaluation in Chicago and interested in obtaining objective data on physical activity of children. For more information, please contact Sarah Welch. As a prospective partner of CLOCC, please consider joining the mailing list and an interest group. Visit clocc.net and click on the Join Mailing List button in the top right corner of the homepage. You can click Get Involved to post jobs and list volunteer needs and opportunities. To find the latest news and events surrounding CLOCC and childhood obesity prevention in Chicago, the News and Events link in the top right corner has the latest information on CLOCC's activities. Thank you for viewing this presentation. If you have additional questions, you can find more resources at clocc.net, or please feel free to email us at info@clocc.net.